So once again, I welcome all of you in this NABH Patient Safety Conference 2024. I will request, please take your seats so that we can start the proceedings and we can concentrate and focus on the subject and topic of this session, which is quality and accreditation. सभी से रिक्वेस्ट है, प्लीज़ आप सभी बैठ जाएं और आप बैठे हैं तो एक बार हमारे पैनलिस्ट स्टेज पर हैं तो एक बार आपकी तालियां ज़रूर बजनी चाहिए आपके विद ह्यूज राउंड ऑफ अप्लॉज लेडीज एंड जेंटलमैन प्लीज़ वेलकम द पैनलिस्ट एंड मॉडरेटर ऑफ दिस सेशन so let me once again and very briefly introduce our panelists. This session is going to be moderated by Dr. Narottam Puri ji and 5 दशकों से भी ज़्यादा कम्युनिकेशन का ब्रॉडकास्टिंग का ये तो एक अलग तरह का एक्सपीरियंस, लेकिन इसके अलावा जो क्वालिटी और पेशेंट सेफ्टी के क्षेत्र में उनका बहुत अग्रणी योगदान है, बहुत महत्वपूर्ण योगदान है. As a principal advisor to the Quality Council of India and advisor to Fortis Healthcare, he has significantly influenced healthcare standards and played a key role in NABH's establishment. His leadership was crucial in Max Healthcare becoming one of the first NABH accredited hospital. So we welcome Dr. Narottam Puri in this session as a moderator of the session. We have Dr. Giridhar Gyani ji as Director General of the Association of Healthcare Providers India. Dr. Giridhar Gyani ji is pivotal in advancing a safer and more affordable healthcare system. His decades of dedication, including his role in founding NABH, have significantly transformed the healthcare landscape and prioritized patient safety. We also feel honored to have with us in this session Air Marshal retired Dr. Pawan Kapoor ji. Air Marshal retired Dr. Pawan Kapoor ji, former Director General of Medical Services for the Indian Air Force, is a distinguished expert in quality management and healthcare with a master's in hospital administration from the AIMS and roles including principal assessor for NABH and chair of the several NABH committees. He has been recognized with the Ati Vishisht Seva Medal and serves as honorary Vice Chancellor of Lincoln American University. We welcome Air Marshal retired Dr. Pawan Kapoor. So we have with us in this session Dr. Upasana Arora also. Dr. Upasana Arora is Managing Director of Yashoda Super Speciality Hospitals in Ghaziabad, ladies and gentlemen. And she holds key positions including Vice Chairman of the CIA UP chapter and member of the National Health Authority. She also serves as the Brand Ambassador for NABH and is involved in national and international committees, including as National Chairperson of the Indo-American Chamber of Commerce, NIC Committee on Healthcare, and co-chairperson of FECI's Medical Tourism. So we welcome Dr. Upasana Arora. Dr. Sonia Trika is with us in this session. She is a member of the Public Service Commission of Haryana, has over 3 decades of experience in clinical practice and public health, a gold medalist in obstetrics and gynecology with an MSc in public health. She has led transformative projects as former Director General of Health Services in the state of Haryana and collaborated globally with WHO, UNICEF, and the World Bank. And we also have Dr. Anupam Sibal in this group as panelist. Dr. Anupam Sibal is a Group Medical Director at Apollo Hospitals, is a renowned pediatric gastroenterologist who established India's first private pediatric gastroenterology and hepatology division and launched the country's first pediatric liver transplant program. He also founded the Global Indian Physician COVID-19 Collaborative and has held leadership roles in JCI and NABH accreditations. And Dr. Anuj Sharma is also with us in this panel. And Dr. Sharma, with over 30 years of experience, ladies and gentlemen, is a leading expert in antimicrobial resistance and infection prevention and control at WHO India. He has been with WHO since 2001 and previously served as the senior consultant at Sarganga Ram Hospital. So, आपकी तालियों के साथ with a huge round of applause, let's welcome all the panelists in the session, and I will request Dr. Atul Mohan Kochar to please come on stage, the CEO of NABH, to felicitate, to welcome all the sitting panelist along with Rizwan Sahab. Rizwan Sahab is chairperson of NABH. तो इन सब का बहुत बहुत स्वागत, बहुत बहुत अभिनंदन है आज के इस सेशन में. इतना सारा एक्सपीरियंस इन्हें अपने प्रोफेशनल फील्ड से अपने ग्रास लेवल तक काम करने का जिनको मौका मिला और जो कर रहे हैं, आज भी कर रहे हैं, ऐसे हमारे पैनलिस्ट हैं, एक्सपर्ट्स हैं इस सेशन में, जो इस सेशन के टॉपिक के साथ साथ ऐसे भी बहुत सारे बिंदु, ऐसे पॉइंट्स भी, ऐसे कुछ चीज़ें निकल कर आएंगी जो डेफिनेटली एक विकसित भारत में स्वस्थ भारत का जो एक फैक्टर है जो बहुत इंपॉर्टेंट है, उसके बिना विकसित भारत तभी पूरा होता है जब हम हेल्थ सेक्टर को इतना इम्प्रूव कर सकें। तो उसमें ये जो डेलिब्रेशंस हैं, ये कंट्रीब्यूशन इन सब की है, आप सब की है, वो बहुत इंपॉर्टेंट है। और उसी क्रम को आगे बढ़ाते हुए आज के इस सेशन में आपके सामने ये चर्चा हम शुरू करने जा रहे हैं, विच इज़ वेरी इंपॉर्टेंट इन हेल्थ सेक्टर स्पेशली, क्योंकि क्वालिटी और एक्रेडिटेशन उसके थ्रू एक बेंचमार्क जो इंटरनेशनल लेवल पर जिसको फॉलो किया जाता है, नेशनल लेवल पर जो इंपॉर्टेंट है उस सबको। सो वी विल हैव a group photograph first, and I will request all the panelists to come forward for a group photograph so that we can click it and frame it, then we hand over it to them at the last in the session. So एक बार इन सब का आपकी तालियां बजेंगी तो और भी ज़्यादा अच्छी स्माइल और एनर्जी के साथ एक वाइब्रेशन जो है वो फोटो से भी आप महसूस कर पाएंगे। सो आई वेलकम all the panelists. Thank you very much for joining us. And without any delay, now I will request Dr. Narottam Puri ji to start the proceedings, please.
Good morning, ladies and gentlemen. Welcome on behalf of NABH on World Patient Safety Day. September 27 is a day we should all recognize, remember, and probably celebrate in our respective hospitals. It was Professor Lucian Leap, a graduate of Harvard Medical College, Medical School, who first advocated the idea of patient safety. He proposed it in US Senate, and from then onwards, quality is inseparable from patient safety, and that is how it should be, as we've heard in the first two panels. By the time Jinendra was talking and introducing us, 10 people have died because of preventable medical errors all over the world. Each year, about 2.5 million people die due to medical errors. 4 in 10 of all who receive primary health care die or are affected by some medical error or not. And about 80% of them are preventable. 1 in 10 in high-income countries in hospital care is harmed. And about 15% of OECD countries, expenditure of time, money, and energy is spent on resolving issues because of medical errors. We talk about a lot of preventable diseases, but for some strange reasons, we don't talk about medication errors, which account for 50% of all medical adverse events. Majority of them, we know, are preventable. We live, particularly the doctors, particularly the specialists, under an illusion of perfection. Healthcare is far from perfect. It is therefore all the more the responsibility of each one of us to follow the principles of quality and safety. I think the subject should be renamed. It should be called Quality and Safety, because ultimately this is going to help not only the public healthcare system, but also the private healthcare system. Like you, today I intend to learn, sitting here. I have with me a distinguished panel, and I'm going to begin without further ado by shutting up and letting somebody who started the accreditation movement in India when he was the Secretary General of Quality Council of India, and he became also the first CEO of NABH. I'm referring to Dr. Giridhar Gyani. A lot of people think of him as a doctor because so great is his knowledge of medical words, but he's actually a PhD in quality. He's an engineer, but therefore knows processes. And he did PhD in quality. He is virtually what I call him very often as the Bhisham Pitama of the quality movement in healthcare in India. So I'm going to ask him to speak a little bit about the history of the quality in healthcare, particularly with regard to accreditation and how it has affected the patient safety movement over the years. Giridhar ji, please.
Okay, thank you very much, Dr. Puri. See, when I see this kind of attendance, really it emotionally makes me to feel that how we started in a very humble manner and where is NABH today, I was actually in Bhubaneswar just 2 days back, and in the evening there were a young clinician, just passed out the MD and worked for 2 years, 3 of them. And they were speaking so fluently on the clinical indicators, I was really very surprised that in our time when we started in 2006, I remember we were telling hospital, actually we were so happy that we are launching the standard based on the International Society for Quality guidelines. And you must understand that the birth of NABH is from none other place other than the Parliament. In fact, it was the Parliament of India which initiated the discussion that we should have some kind of accreditation or recognition. And from Ministry of Health, it came to Quality Council of India. And that is where the journey started. So that actually is the starting of the NABH. And we, as a Secretary General, my that time problem was, I had a background on quality, bit on healthcare from my UK training, but nothing more. So my job was, out of so many doctors, how do I pick up 5? I think the God helped me that time, let me tell you very clearly, because people gave me a lot of credit for this. But the credit is that I picked up the team of 5 who really exceedingly involved so much. They forgot their practice. Every Saturday, Sunday, from all parts of the country, they will come, assemble, write the standard. And again, when I found these are the 5, who should I choose to be the chairperson? So with my bit of defense R&D background, I said, let me choose Fauji and Colonel Pawan. And actually, he never disappointed, even till today. I think he is I don't want to use the words. He remained with me. Again, after launching the standard, let me tell you, we thought people will jump at it. But no, people were not coming forward. They say, what is this NABH? Every Saturday, Sunday, again, myself, Yashpal Bhatia, Pawan, Murli Srinivas, we will go Bombay, Calcutta, conduct seminar full day, struggling to make the people understand. And then, of course, in 1 year, only 37, I think, application came, and only 5 could qualify. Again, our luck was that these 5 certificates, Dr. Abdul Kalam agreed to come and present these certificates. That again was another breakthrough. And of course, that is a journey, because then people say, oh, if we get accreditation, President will give us the certificate. Anyway, I think what I'm trying to say, you see that journey has been phenomenal. And as I said, doctors, even the housekeeping staff now, they understand the meaning of NABH, the kind of ownership they take. In fact, one of the hospitals I recently went, people used to say that clinicians do not work as a team. I tell you, I went to one orthopedic department, 2 spine surgeon, 2 orthopedic, 1 pain management, and one of the patients was related to me. I was there. Normally, their doctor will take up the case and deal himself. This time he said, Gyani ji, I think we will go and talk to spine pain management. He stood up along with me, went down. So I realized that this is the team we have been talking in the NABH. And I'm told that many of the hospitals now, they follow that. The involvement of clinician which we used to complain, sorry, it is not there. Clinicians have taken the ownership fully. Now, only thing is I will try to tell NABH, of course NABH is here. You know, when we started, first help came from CGHS, but that was only marginal. Then you know what we did? Because I was taught in my initial days that you can promote quality by 3 methods. One is by regulation. Government ke paas danda hai, regulate, you have to do this. Second one was in the healthcare by payers. And that is the most common way of promoting quality or accreditation, payers. So CGHS was first help to us. It really made a huge difference, no doubt about it. RSBY, all those things came. But I knew that most effective will be when the common man starts demanding accreditation. And you know, Dr. Kocher is not here. What we did on 4th year, of course, Secretary General is sitting here. You know, what we did in 2009, big advertisement, A4 size, in main paper in cities like Delhi. What was there? 14 names of the hospitals which were given accreditation in Delhi. And what we wrote simply, accreditation means quality and patient safety, nothing else. We only wrote this much. We wanted to, you know, that was what happened. 11 hospitals' names are there. The other hospitals said, oh, our name is not there. People are really reading this, that accreditation means quality and patient safety. Again, it made the huge rush. So I only would like to advise now, I'm not here to say that we must promote NABH for heck of it. No. Because NABH leads to patient safety, minimizing of medical errors, and a lot of other things. From that point of view, we have to now drive the NABH accreditation through the consumers. Jago, Grahak, Jago kind of thing has to come now. And that kind of effort if we put and convey this message that accreditation, that means the next time a patient comes, first question he should ask at registration, are you accredited? No, sorry, I'm going out. I mean, that is the kind of image we have to build. And I think this is possible that this we will be able to spread. And of course, today I could also tell you that the medical tourism, some of the hospitals are doing phenomenally well. And all again, because it is NABH accreditation through the ISQA, and our participation in ISQA has been again fantastic. I myself have been director on ISQA for 4 years, and my predecessor also have been very participating. So I think this journey, the way people are taking, I am very happy, very thrilled, and I want to compliment the management of NABH and of course the leadership of Quality Council of India that we are here, but journey is not over. We have still a long, long way to go to make the impact and make our healthcare safe and safe. Thank you very much.
Thank you, Dr. Gyani. You referred to Dr. Pavan Kapoor. He is the architect of the first ever standards of NABH that came out. Air Marshal Pavan Kapoor was responsible for some of those 5 hospitals that Dr. Gyani mentioned, which were the first to be given the accreditation by NABH. It happened right here in this hall, if you remember, by the President of India, and I happen to be one of those who received that. My association dates back to the beginning of NABH when the first standards were presented to us. And I would now like to request Air Marshal Pavan Kapoor, who remains committed to quality in all its myriad forms. He has been virtually the chairman of every committee conceivable. And whenever you are in trouble, my respected members in the audience, just remember one name, Pawan Kapoor. Go to him. He will have a solution. For the 4 years that I served as chairman of NABH, I relied on his counsel. And he has never ever disappointed. So the architect of the NABH standards, Air Marshal Pawan Kapoor, over to you, sir. Particularly kindly focus on the development of patient safety, because we are on the Patient Safety Day. How from the first standard to be released shortly 6 standards has this journey been?
And thank you, sir, for the kind words. Good afternoon, everyone. Well, I'll go to the question that has been asked to me, but before that, I'll say a few words. When we first came into the ambit of Quality Council of India, because NABH did not exist at that point of time, and Dr. Gyani, sir, called me, he says, can you take over the coordination or a chairman of this committee to make the standards? So I asked him, why me? He said, क्योंकि आप सब देश के रक्षक हो. You are from the field of national security. Believe me, I went and read about national security, and national security does not mean only territorial security or space or air security or water security. It also means economic security, and it also means health security. So we made a chart. And we found that everything boils down to productivity. And productivity is based upon health. And health should be secure. Therefore, your first set of standards should focus on health security. And in that, we pitched in with patient safety, community safety, employee safety, environment safety, and the organization safety as well. So when we made the first set of standards, we found that we have done a reasonably okay job, but that is from the point of view of the 5 of us who were given no chance to veto anything. If we do not come to a consensus about a particular objective element or standard, we will fight, we will argue, and if we cannot come to a consensus, we will remove it. Because if these 5 people cannot come to a consensus, the rest of the country will never align themselves with it. With that basis, we started this. And we went to various locations. Like he said, every Saturday, Sunday, we would visit some location or somewhere else. And then we visited Mumbai. Believe me, we are so happy to see this hall today. In Mumbai, the hall was similarly filled when we started. By the time we went to the second session, we were giving them free standards, free tea, free lunch in a 5-star hotel. After lunch, nobody came. And what they said was, this is meant for Western countries. These standards are not applicable to us. The solitary people who stayed behind, they said, how will you have these type of manpower, these type of facilities? Not possible in this country. We can't have such operation theaters. What are you talking? It took us time to get them back again into the hall and then restart the entire thing again as to what we actually mean by these standards. You are safe, your patients are safe. Then we went to Jalandhar. In Jalandhar, they were very welcoming. They gave us big glasses of lassi with lot of malai in it, lot of aloo and gobi ka parathas. And after that, they heard us for full 9 to 5 p.m. And at 5 p.m., they told him, sir, sorry, sir, your standards are not applicable to us. And he said, why? He said, because in Jalandhar, we do not have hospitals like you're talking of. We have nursing homes. We have the highest density of nursing homes in Asia and Jalandhar. And your standards cannot be made applicable to our setup. He came back and he gave us another task, prepare standards for smaller healthcare organizations. So we then adapted to the needs of the environment. So actually, we cut down the documentation and focused more on doable parts in the smaller healthcare organizations. Then came a demand from the insurance. Insurance regulatory body says that no, we have our own indicators, we have our own assessment schemes. We don't want to keep on repeating this job. If NABH can do this for us. So then we thought about why not make something which will allow people to get attracted towards quality, because people are not entering the quality ecosystem in the numbers that we desired. So, we have a system to attract people, so we made standards at entry level. So actually what happened was we started from here, we came down little more, then we came down little more. We did not enhance, attract people to come into the quality system, so entry level standards were launched. Based upon this, we continue to make standards after standards. Now coming to each, the mother standard, like Dr. Sunil Rao said in the morning, is the main hospital standard. How did we improve patient safety aspects in the standards? First, we only focused on basic tenets of patient safety. Patient should be safe. It was left very generic. Few things like patient identifiers, some indicators, they were there in the first standards, and some internal audits to improve quality and improve patient safety, and monitoring of medications. Gradually, we said, no, patient safety is not sufficient in this manner because we are not prescriptive. We are being very, very generic. So we started going through prescriptions. And then we started saying initial assessment should be done within 24 hours. In emergency, at a time frame which should be decided by the organization, but not more than half an hour. So we started becoming prescriptive. Then we said, in the 5th edition, we came out, no, this is not sufficient. So we changed one complete chapter. From continual quality improvement, we brought in patient safety and quality improvement, where patient safety became a separate standard, which incorporated that you should have a patient safety committee, we should be multidisciplinary committee, we should meet at regular basis, we should review your programs on a quarterly basis, we should be updated every year, and we should include national and international patient safety goals. Every chapter, the word safety was incorporated in the 5th edition. Example, AAC chapter 1, lab services should be provided in a safe manner. Radio imaging services should be provided in a safe manner, and at all objective relevance that focus on these safeties. Chapter number 2 is, of course, the master of safety. Care of patients, everything focused on safety itself. Your procedural sedation should be provided in a safe manner. Anesthesia services should be provided in a consistently safe manner. Surgical services in a safe manner. Blood transfusion services in a safe manner. Name any service, obstetrics, pediatrics, rehabilitation, all should be provided in a safe manner. So safety became the crunch of chapter number 2. Medication safety, right from pharmacy services to be provided in a safe manner. Medication should be prescribed rationally and safely. Your medication should be dispensed safely. Your medication should be administered safely. Everywhere the word safe was used in each and every chapter. Pick out any chapter. In NABH standard, you will find the word safe has been used. Then we realized that, yes, patient, where is the patient? So then we said, okay, we must incorporate patient engagement. Earlier on, the first standard said patient education, one-way communication. Educate the patient. 5th edition says patient engagement, patient involvement. Involve the patient. Have patient-reported outcome measures. Have patient experience measures, monitor them. So we started involving the patient. The 6th standard has gone beyond that. And the 6th standard says engage the patient. Involve him in shared decision-making, gradually leading to empowerment of the patient. So the patient came in, and that's how over the years, sir, and all of you, patient safety has been addressed differently, and it has accelerated the requirement of patient safety with the involvement of the patients and the clinicians. So for the time being, sir, I will end here, but I'd like to say one thing. When we started this, WHO had given certain dimensions of quality. And those dimensions of quality were, the first dimension was should be safe. Second was it should be timely. Third one, it should be efficient. Fourth was it should be effective. And fifth was it should be equitable. And sixth one was it should be patient-centric. Today, WHO has, this is the STEEP model we call it. The WHO persists with the STEEP model but change the spelling of STEEP. They say patient quality dimension should be safety and sustainability. So they worked on safety and sustainability. The sixth edition addresses sustainability. Then they said timely, efficiency, effectiveness, and equity stays. Now instead of patient-centric, they said patient-centric and population and people-centric. Means now the community gets involved. So I think when we come to the next level of standards, maybe I foresee it will be a more people-centric standard than only a patient-centric standards. Thank you very much. Jai Hind.
Thank you, Pavan. As usual, very informative. We are somehow missing our WHO participant, Dr. Anuj Sharma, who was supposed to join us. I hope all of you are familiar with the World Patient Safety Day today and the motto that is improving diagnosis for patient safety. This is the year's theme. And of course, the theme is get it right and make it safe. So that's what Air Marshal Pavan Kapoor has been talking about. Now, the next speaker that I have with me is sitting on my right, Dr. Upasana Arora. She is a great ambassador for NABH. And she runs a large institution just outside of Delhi and has been associated with NABH board with a lot of activities in the institutions that actually work for patient safety. So may I request her to add her bit to what has been already mentioned.
Good morning, everyone. I'm standing here and sitting next to my mentors. It's a great privilege and honor for me. Yashoda, thank you so much. My life and my institution, whatever we are today, just because of NABH. And it's not that I am talking about this in this conference because I am sitting with the NABH people. You can see my all interviews in magazines or podcasts, whatever. Because we are into this healthcare. Yashoda started in 1990. And we were running hospital like everyone was running that time because there was no concept of quality or accreditation in India. Anyhow, we started our accreditation journey in 2008 when Dr. Sunil Rao came to our hospital as an assessor. That time it was mandatory to go for pre-assessment. And whatever he told us, we were actually, Dr. Rao is there and he can vouch for me, we actually did everything like from full-heartedly. It was not like we were giving just to show him. Because I just want to tell all of you who are new to this, for me telling all this thing in front of all stalwart is like Suraj ko diya dikhana. But for a young generation who is sitting here, I really want to tell you, patient safety is the key mantra for success of your hospital, your institute where you work or you run. Same time, your intention has to be very clear. It has to be honest. It should not be for accreditation, certification, which you are going to hang on your wall. You have to implement everything. Like my hospital is so transparent, anybody can come anytime, do any kind of audit. Like yesterday I got a call from NABH and they said stroke standards are here, some certification. And I want that you would be part, would you like to be part of this? I told them, Yashoda is just a part of NABH. And I extend my gratitude towards this NABH and especially to Gyani ji, who is not only my mentor. this thing has changed totally, Yashoda. Now you can see we are coming up with a big hospital. My existing hospital become, that time it was 100 bedded and now it's 300 bedded. We are running education, everything. And why? Because we are following all the standards by heart. Not, my team is here who is from the beginning with me. They are pillar of the institute, because that time I was taking classes of my all the staff, and I was used to tell them, eat NABH, drink NABH, sleep NABH. This was our tagline. So my experience with accreditation is too good. Luckily, Gyani ji and me both were in Scotland for ISQA conference, Edinburgh, and from that time I was listening all those speakers. I was thinking everybody is talking about different kind of accreditation, but my standards are really good. NABH is not less than any standard, and it's international also. So I can say that there is all the time everybody game changer. So I must say in healthcare, NABH is a game changer, because it is not only talking about patient safety, it's talking about staff safety also, which is very important. We need to take care of our staff also. It's not only patient who is run, because of patient you are running institute, but running by whom? By the team. Team has to be safe. So my experience is this, that you need not to go for any kind of marketing, any kind of branding. If your patient is safe, your staff, your team is safe, they are happy with you, you need not to do anything. Everybody, one patient is sending more patients. So we are real example for that. I don't have any marketing team. We don't have any, branding agency. But still we are growing, because we are doing it from the bottom of our heart, and we are doing it honestly. Whatever is written in all standards, we are following it. Now I am sitting less in my office or my hospital, but everybody knows what they are supposed to do. We have adopted digital standard also, and as Dr. Gyani was telling you, that now clinicians are totally involved. In my hospital, all clinicians are the bosses in their own department, and they are following, and they are telling us all the presentation when we are doing this, our quality, everyone there is a quality meeting. So they are the one who are presenting. So it's a very necessary thing. They are the one who are treating the patient. So NABH every time, rather I am all the time telling Pawan sir, why you are making it so complicated for others, but it's really good, and we are very, very happy. Rather, I want to tell that there has to be, sir, a standard for, like you have introduced, stroke. So such kind of things has to be there, and any NABH accredited hospital should not think they are accredited, why they are going for blood bank accreditation or something like that. I am telling everybody, if you will got an accreditation certificate, after that if there is any like emergency standards are introduced or stroke standards, one has to adopt, because in Yashoda's success and Upasana's success, only one thing is there. सब लोग कहते हैं ना, भगवान ने बहुत साथ दिया. Actually, after God, if somebody is there, that is NABH. Thank you so much. Yeah, sir just asked me to tell. I am the first ISQA fellow, and this credit goes to Gyani ji, because he took me there, and I realized the value of ISQA. Thank you.
Thank you, Pasna. An objection, I was also there in Edinburgh, you didn't notice me. So from the point of view of implementation of accreditation standards and how it results in patient safety, how it manifests itself in patient bringing a patient, is an example that Upasana Arora just talked about. The question really boils down in healthcare in India is to the implementation part. Organizations such as QCI and NABH can only make the standards. Of course, they make them with pilots nowadays, and you're involved at every stage. But ultimately, healthcare is a state subject. And there are two impediments that one usually finds if you are on this side of the bench, that is on the NABH and QCI side. And that is, one is how to involve smaller units, primary care, smaller hospitals, because SHCO, there are fewer hospitals. And the second is how to involve government hospitals. So my next speaker is Dr. Sonia Trikha, who used to be the Director General of Health Services of Haryana and was directly involved with NABH2. She served with me in the Appeals Committee for many years, and she's currently representing the Haryana as a member, the Haryana Services Selection Committee. So any one of you looking for a job after this event is over, please corner her. She will tell you how, when she was in the saddle, and still is in a way, they have implemented these standards, and how the standards of the Indian sector of government and public sector are infiltrating slowly, or getting infiltrated slowly, by patient safety and accreditation. Dr. Sonia, please.
Thank you, sir. Good afternoon, everybody. What do you tell such an august audience, many of whom have been, I see some of them sitting here who were part of the trainer team when they came to train us on NABH standards in Haryana, way back in 2014, I think. So I'm just going to use this opportunity because I've worn many hats in more than 30 years of my career, so I'm just going to distill some of that experience into, what that means for patient safety. Patient safety, in my understanding, is, of course, it has two components. Patient when the patient is inside the hospital, and patient when he's not in the hospital, hasn't reached the hospital. So those different hats that I've worn in my career, maybe I'm going to divide them into three categories. One, of course, as a clinician, when I began as an obstetrician and gynecologist, like more than 30 years ago. What was my experience like, and where were we? I'm sure many of us know that we craved and we wanted so many facilities, which now we know that as part of NABH accreditation or any other accreditation method that you choose, all of them are a given. So it's not just for the patients that the hospital complex becomes safe. It is also for the hospital, the visitors, and for everybody who comes to that hospital. It could be a vendor. So I feel that today's generation, when they come to join any of the hospitals and even in the public sector, they get a much, much safer environment, but there is so much more that needs to be done. So we talk about, the incentives that a hospital gets. For example, let me just come back to the public sector here. When we started talking about quality and patient safety in the government hospitals, we started with NABH way back. And we started with the core team, started training like 20 people. We actually had to choose from 22 districts of Haryana. We had to choose basically people who were motivated, committed. And then from their experience, how they presented that now, in the same hospital, it's not just the patients, but also the doctors who feel so much more comfortable and so much safer that the other hospitals started working. After we had, already gotten 4 health facilities accredited, the newer standards came into being, which are the National Quality Assurance Standards, which are the Government of India's standards. Many of you might have heard about NQAS. I don't know, the younger lot might have heard, which is more applicable to the government health facilities. I remember when I just joined and I was wondering whether I should be going for NABH or NQAS, and both of them had, some pluses, and we chose NQAS because there were a lot of incentives in the National Quality Assurance system. So for the public hospitals, when you get your 300-bedded hospital accredited or certified, by the end of 1 year, you get 30 lakh rupees, which you can use in whichever way possible. So we started having better duty rooms for the doctors, better, like coffee rooms, or things which we were not getting as part of the government aid that you get every year in your annual plan. So that's what became another facilitating factor or a catalyst for more doctors to come forward and more doctors to have, standards on patient safety as well. Here, my mind is going from one place to the other because there's so much that happened during that time. Let me come back and wear the public health expert hat right now and see where is it all emanating from. When all countries we know on this International Patient Safety Day, we must also remember that there's such a bigger canvas out there. Where do we fit? Where does quality and patient safety fit? The universal health coverage that we are all striving to achieve, it's one of the Sustainable Development Goals, the SDG 3. And if we talk specifically about the target, it's SDG 3.8, which talks about all people, wherever they live, irrespective of rural, urban, man, woman, child, LGBT, whatever, that all people must have access to full range of quality services when they need, where they need, without any financial burden. So this itself is such a huge, such a big target, and quality comes here, which is a challenge for the public sector, because where do you place this quality in the public sector? So you have NQAS standards for district hospitals, for the smaller facilities, the CHCs, the PHCs, and to have universal coverage, health coverage, there are two systems that our Honorable Prime Minister, Shri Narendra Modi, has envisaged. And those are that you have services as close to a person's house as possible, which we are now calling as Ayushman Arogya Mandirs, which used to be these sub-health centers earlier, and now we say that they were health and wellness centers because the focus is not only on curative, but also on promotive, preventive, curative, rehabilitative, palliative, everything. So from that small basket of service which used to contain only maternal and child health and immunization, you also have 12 services starting from the point the baby is born till the, as long as the person is alive. So you have all of those, preventive services included. And the second part of this is empaneling more and more hospitals so that if there is a curative service required which is not available in this Ayushman Arogya Mandir, the patient is able to go to a private hospital, which brings us again to empanelment. Now, how do you choose these private hospitals? More and more states are now wanting to have empanelment. And what kind of empanelment? If a hospital is NABH accredited or any other accreditation, then you know that some bit of quality and patient safety is inherent in the service provision in that hospital. So just for you, which all of you might be surprised that there are 139,000 Ayushman Arogya Mandirs, the health and wellness centers. So it could be close to 1.5 lakhs by now. How do you check? So there are virtual dashboards, virtual platforms to see the components of patient safety. And in government hospitals, let me just give you one example. When we started working on it, we found that the hospitals do not even have the land ownership certificate. So from there to ensuring that they have statutory compliances, which includes the fire NOC, which includes the lift licenses, all of this was like very foreign to many of the hospitals. So in a period of 4 to 5 years, a lot has been achieved already. And to percolate this to a village level, basically all of these health and wellness centers are at village level, to see that all of them are meeting the same standards, meeting those same criteria is a very, very ambitious target, but we've started achieving it. And I'm sure because there is a target set now, that by the end of 2025, December 2025, 50% of all of those public sector health facilities must have certification or accreditation. And by December 2026, 100% of those must have an accreditation or certification, which is quite ambitious. Another thing which I learned just now from one of the speakers who just spoke before me, that it's not just that certificate or the accreditation certificate that you're hanging on the walls. It's journey. It's a journey, continuously evolving journey. So you start, you take some steps, you reach a milestone, but it doesn't end there because it's just a beginning. So it's a process that you've just started. On patient safety, on this Patient Safety Day, I just want to say that for achieving universal health coverage and for actually making a difference to the society, we need to also ensure that the referral system, that when patient comes from community or to our hospital, also is as strengthened and as efficient as it should be, so that we are able to save more and more lives. Thank you very much.
Thank you, Dr. Sonia, for bringing in the angle from the public sector point of view and also really taking it down to the rural sector. Thank you very much. There are very few people actually in a healthcare conference that I would walk miles to hear. The next speaker is one of them. Dr. Anupam Sibbal, the Group Medical Director of Apollo, happens to be a classmate of Dr. Sonia Trika in their MDs together. She did Gyani, he did pediatrics, and unfortunately so well does he speak that it is often forgotten that he is a leading hepatologist, pediatric hepatologist in the country. Anupam, over to you.
Good afternoon. Thank you very much for that very kind introduction. Next time I want to feel better, I'll just pick up the phone and call up Dr. Puri. Mr. Rizwan, Mr. Shah, Atul, the amazing team of QCI, NABH, friends, it's a privilege to be here today. Gyani ji, you started this revolution, and I distinctly remember when we first started talking about NABH and how we had so many meetings to draft the first set of standards in our boardroom. Pawan ji, whatever responsibility you take on, you deliver more than 100%, whether it was NABH standards or we recently saw how Pawan ji organized the GAPIO conference in Antigua in the middle, in the West Indies. So really amazing to have you here. Dr. Puri, of course, all of us look up to always someone who inspires, who guides, who's so generous with his advice. My dear friend Upasna ji, आजकल आप जहाँ जाएंगे वहाँ आप Upasna ji को पाएंगे. She's here today, tomorrow she's in Lucknow, day after she's in Bombay. And by the way, मैं भी Edinburgh में था. And of course, my dear friend Sonia. We heard about the NABH journey, the patient safety movement, this whole focus on quality that we are seeing in the country. We heard about the benefits, we heard the government perspective and how this is taking off. But I just want to pause and look at something different. Now, if we look around these days in life, don't we hear more about safeguards, rights of consumers, certification, accreditation, the regulatory framework than we ever did? It's pretty common these days for DGCA to say, okay, 10% of your flights off because of this violation, or we penalize an airline for some non-compliance. SEBI has become really strict to protect the shareholders. RBI has a very, very strict sort of regulatory framework. We have RERA to protect household buyers. When you talk about university education, out of the 1,074 universities in India, 76% are accredited by NAC. So clearly, there is this movement in terms of the framework approach. But when we talk about health, that sadly is missing, even though all of us here realize that life is priceless. The accreditation journey or movement in India started in 2005 when Apollo Hospital Delhi became the first internationally accredited hospital by JCI. We were the first in India at that time and sixth in Asia. A few months later, the dialogue started with QCI, NABH was born. And I was just looking back And this is data that I could get hold of. It might not be very accurate, because one of the problems we have in India is the accuracy of data. There are only 55 JCI accredited facilities out of the 27,742 hospitals that are listed on the website of the Ministry of Health and Family Welfare. I believe less than 3,000 have complete accreditation of NABH. Universities 74%, hospitals 11%. Why is that? We've been talking about this for 17 years. Our 6th edition will be out. Why is it always limited to 500, 700, 2,000, 4,000 people who actually feel passionate about it, though we have 27,000 hospitals and several million beds? The reason is that there is no incentive for accreditation for patient safety in our country. 10% reimbursement on CGHS or insurance is not going to help us achieve what we want. At the rate at which we are growing, none of us will be around to see every hospital in India accredited. Why did America succeed? Now, they also don't have a law that mandates accreditation, but you don't get reimbursed if you don't have accreditation. This can be the game changer. All of us should push. We should push for legislation. If you're not accredited, you don't get reimbursement, whether it's private insurance, whether it's nationalized insurance, whether it's Ayushman Bharat, whether it's companies paying bills. If you're not accredited, you don't get paid. In 5 years, every single hospital will have to be accredited or they'll have to close down. The other thing that we have to address is that we thought that, and we had made progress during COVID, that we broke these silos between private and public health. We came together to fight COVID. There were about 37% of all ICU beds were in the public sector, the remaining in the private sector. 43% of all labs were public, 57 were private. When it came to developing the vaccine, ICMR collaborated with a private company to develop the vaccine, and out of the 100,000 vaccine centers, 97,000 were in the government sector. We didn't talk about private or public. We talked about One Health, protecting the country, protecting the citizens. I think we have to break this, because when I look at data of the NABH accredited hospitals, about 10% are public. Why? Why the distinction between public and private? If we are to become a healthy India by the time we become a developed India in 47, we really have to move faster. There's some amazing movement happening. When we look at Ayushman Bharat, we look at PMJ, and Upasana ji and I sat on the committee that reviewed the guidelines for PMJ, whether it's Abha, whether it's Bhim, or whether it's the Arogya Mandir. There's a lot happening. But I think we need to add safety and quality to that narrative. Why should NABH not accredit the 150,000 Arogya Mandirs? Now with Ayushman Bharat, every public hospital has to be accredited as part of the NHA agenda. Why don't we link reimbursement? And automatically, every public hospital will have to get accredited, and I think that's where we need to push. There's been this concern about human resources. I think that's been addressed. More than doubled medical colleges in the last 10 years, more than doubled the number of seats. We now produce 105,000 MBBS students every year. And the total number of doctors in Australia, it's less than 1 lakh. So it's not that we produce one Australia every year because we have 25 million births, but we also produce more doctors than Australia has in 1 year. But what we need to start focusing is on the level of training. So NMC has an accreditation board that looks at rating. We have now the Nursing Act. We have the Allied Healthcare Workers Act. We need to bring quality as part of the discussion. And of course, when we start talking about quality, we will have to emphasize on patient safety. And we know that hospitals that were accredited found it easier to handle the pandemic. They didn't have to go back to the drawing board because you're supposed to prepare for disasters. Hospitals that are accredited do not have safety problems like non-accredited hospitals because you're supposed to have codes, you're supposed to check, your hospital has to be well lit, you have to have security. So there are numerous advantages, not just for patients, but also for the workforce and in the environment we live in where I think the workforce today feels that there needs to be more in terms of protecting their rights and safety, I think accreditation is another tool that I think we need to embrace. I want to congratulate NABH for this event and of course for bringing all of us together as you do every year and for the next set of standards. Thank you very much.
Thank you. Thank you, Anupam. Ladies and gentlemen, I'm looking at Atul to tell me whether there is time for a couple of questions or not. But just a couple of points. I think we need to understand that patient safety requires a total commitment on behalf of patients as well. In a country like India, you know, usually grandmothers decide the dose of the medicine because they decide that you've taken 500 milligram 3 times, that's a very high dose. So let me reduce the dose by half. That is also contributing to lack of patient safety. Then chemists dispensing medicines, that is also compromising patient safety. Yet the only blame is of to doctors and nurses. So inpatient, what I told you, the statistics in the beginning apply. But a lot of harm, particularly by medication errors, is constituted outside the hospitals. And to that extent, we've got to educate the patient much more than we've already done and hold him or her equally responsible for some of the events that take place outside the hospital. But within the hospital, the systems, the processes that help, such as NABH or any other accreditation system or certification system, need to be followed by this country. Dr. Anupam Sibal referred to mandating versus voluntarily doing accreditation. Other than 3 or 4 countries that I'm aware of, nobody mandates that you've got to do quality. Therefore, the answer, like he said, comes out of incentivizing. And Dr. Sonia Trikha gave you an example how NQAS is actually incentivizing the hospitals by giving them cash. That's what gets a government hospital interested in applying for a certification program. But we've got to decide as we roll along, what kind of a quality system do we follow? Improving the quantity is important, but improving the quality of the quantity that we produce is a vital element, particularly in healthcare. Dr. Atul Kochhar, may I throw this open to the public? Is it no or yes?
No, it's a no.
It's a no. Because his neck was moving this way and his neck was moving this way. And following my cataract surgery, I can't really see. So, ladies and gentlemen, you've been a wonderful audience. I've been privileged to be a part of this panel. I've learned so much from Dr. Gyani, Air Marshal Kapoor, Dr. Upasana Arora, Dr. Sonia Trikha, and Dr. Anupam Sibal. Ladies and gentlemen, please give them a big hand.
Thank you so much, Dr. Narottam Puri. And I will request Rizwan Sahab to please come on stage, Chairperson NABH and Dr. Atul Mohan Kochhar, CEO NABH, और एक मेमेंटो साथ में फ़ोटो फ्रेम जिसमें इस मोमेंट को हमने कैप्चर किया और उसको फ्रेम किया है, तो वो आपकी मेमोरी के लिए और आपके कलेक्शंस में भी रहे। हम सबको इससे और पूरे देश को बहुत इससे लाभ मिलना है। और उसी कड़ी में जब विकसित भारत की तरफ हम आगे बढ़ रहे हैं, हेल्थ सेक्टर को क्वालिटी के हिसाब से, क्वांटिटी के हिसाब से, हर लिहाज से उसको बेहतर से बेहतर बना पाए। तो ये इन सभी हमारे पैनलिस्ट के लिए बहुत बहुत we are grateful to all the panelists, all the experts in this session, which was based and which focused on quality and accreditation, laying the strong foundation for a Viksit Bharat, ladies and gentlemen. इस सेशन के बाद एक स्पेशल सेशन भी है हमारा, और आज शाम तक बहुत सारे ऐसे अलग अलग डायमेंशंस और एस्पेक्ट्स जो हैं हेल्थ सेक्टर के, जिसमें पेशेंट सेफ्टी हमारा एक की पॉइंट है, और उसके इर्द गिर्द ये पूरी चर्चा और पूरा प्रयास हमारा है जो आगे बढ़ रहा है, क्योंकि एक ट्रस्ट हेल्थ सेक्टर में हेल्थ प्रोवाइडर की तरफ से अगर बनता है कंज्यूमर के मन में, तो उस सेक्टर को उससे बहुत बढ़ावा मिलता है। और सिर्फ देश में ही नहीं, बल्कि क्योंकि हेल्थ सेक्टर इतना ग्रोइंग सेक्टर है देश में, तो वो दुनिया के लिए भी एक मॉडल की तरह सामने आता है। तो आज के इस सेशन में डॉक्टर गिरधर ज्ञानी, एयर मार्शल डॉक्टर पवन कपूर, डॉक्टर उपासना अरोड़ा, डॉक्टर सोनिया त्रिखा कुल्लर, डॉक्टर अनुपम सिब्बल, डॉक्टर अनुज शर्मा एंड डॉक्टर नरोत्तम पुरी। तो एक बार आप सबके तालियों के साथ, बहुत सम्मान भरे तालियों के साथ, with a huge round of applause, ladies and gentlemen, let's extend our gratitude to all the panelists in this session. This was our third session of this NABH Patient Safety Conference 2024. Thank you very much.